Legislature for millions more, while also proposing a major overhaul. News 4's Sydney Batzloff breaks down the ask and what could change.
Oklahoma's Department of Mental Health Services has struggled financially for years. They're in the red again, trying to cover care with much less financial help from the federal government.
It's become apparent that this federal match is something that we underestimated.
We are going to be asking and have asked the legislature for additional appropriations.
Secretary of Health Clay Bullard says instead of an extra $20 million to cover a funding hole in Sooner Care services, the state actually needs more than double that. That's because instead of covering 90% of Sooner Care costs, the federal government now pays just 67%. Also, after losing in court, the state must fix the system that's left inmates in county jails for months, even years, waiting on mental health treatment.
The consent decree could cost Oklahoma upwards of $100 million. And I think that number is low from what little bit I've seen.
Slavonic says at least $30 million is needed to shorten those wait times for inmates. And over $20 million more will be needed to upgrade the state's technology.
So we need new software to streamline our finances. We need to have a electronic health record.
State health leaders are also proposing a major restructuring, bringing mental health under the umbrella of the state health department and suggesting more privatization.
We continue to see the government is not great at managing facilities and large numbers of staff. Private companies can do that much better and can deliver services.
And Sydney Batzloff joins us now to break down her story. Welcome, Sydney.
Hello, Heather. Excited to be here.
I'm glad you're here. Okay, so let's first talk about these changes. For these changes to be made, what has to happen first?
Yeah, Heather, well, it's important to know that these changes aren't in effect now. It's just a proposal. Bullard said today that really what needs to happen is the legislature. They would have to draft a bill. This would have to go on at the state capitol, and then it would have to go through that process. As of now, he said no lawmakers has drafted this. He's hoping, though, that it would be done this session. He says it is a timely matter. So right now, just kind of a wait and see if a lawmaker picks this up, and then, of course, going through that process ultimately to the governor's desk, seeing if that's signed, then these changes would go into effect. So still a few more steps to happen.
Right. So if this restructure does end up happening, then would it also come with some leadership changes?
It would. That's part of the proposal as well. Slavonic, the current commissioner for the Department of Mental Health, he's actually set to retire at the end of this legislative session.
Okay.
He was actually going to leave his position earlier, but he decided to stay longer, go through this session. So the proposal right now, the commissioner of the Department of Health would actually get a dual role. So he would oversee both the Department of Health and then also the Department of Mental Health, and have both roles since he already kind of has experience. He knows what these proposed changes are. So that's kind of what would happen there. Again, with that, they would have to ask the legislature for that temporary allowing of letting him have two roles.
And how about mental health services to those who are currently receiving them? Will there be impacts on the people receiving benefits right now if this passes?
Right, great question. I feel like a lot of people at home probably thinking about that. You hear this and you're like, oh no, are my services going to be impacted? As of today, they said no, if these changes happen, all services will stay the same. So no impact as of now there, which is important to know for sure.
And as far as the finances go, they also mentioned some ways they're trying to save and bring some money in. What are they looking at?
Yeah, something else that was brought up with this is the Medicaid eligibility and how Oklahoma compares to other states. Something they found is the threshold when it comes to other states. Oklahoma is 62% higher than the federal average that they put out. So they would, with this rule, if it went into effect, they would go to the federal average, and then they estimate that could save Oklahoma $10 million every single year. And as we know, the Department of Mental Health has had some budget issues, like in my story that I mentioned, and this has been going on for a couple years. So any way that they can find to save, it's important.
It's very important, Department of Mental Health for sure, and getting people the services they need. We heard in the prisons, it's been years since some of them have been treated. So necessary. Sydney, thank you so much.
Of course. Thanks, Heather.
We appreciate it. Making Midtown more walkable, the big construction project, and how long a major road will be closed.